CJOB.
Richard and Julie with you. Great to have you with us this Wednesday afternoon. We're on weekdays from 3 until 6 o'clock. The provincial government earlier today announced it's expanding staff and equipment at the Sleep Disorder Centre at Misericordia Hospital. The health minister announcing it will increase the number of patients that it can handle by 200 a month over the next couple of years. Cost of the agreement, $1.8 million, funded by the Diagnostic and Surgical Recovery Task Force. There is a dispute between the group doing the work at the Misery and the government, which has also contracted out some of the diagnostics to private contractors. Earlier on the news, we spoke with Dr. Peter McDonald, chair of that task force steering committee.
The wait time is significant. The numbers of people waiting are in the thousands, although we haven't been able to accurately quantify the numbers waiting because the Sleep Disorder Centre has not turned over their wait list to government, but we're hoping as part of this agreement that will take place.
You could certainly tell in the tone that they're wanting that group to do so. Thomas Linner is with us. He is provincial director of the Manitoba Health Coalition. Mr. Linner, good to talk to you again. Thanks for joining us.
Hey, no problem. Good to be here.
What's the nub of this dispute here?
Well, we know that all along the sleep doctors have been concerned that their desire to put patients first has been held back by a government that is bent on pursuing private options. And I'm not a sleep doctor, and I don't play one on the radio either. But I don't believe that the government or its task force should be holding investments in the public system hostage so that private companies are assured to continue to get on the action. I really think that that's a big part of what's going on here.
So what's the better option here?
Well, I'll start with this. This $1.8 million investment is the lowest possible fruit. It's been called for ages, since before the pandemic. This investment could have been made on the same day that the task force was announced, and patients would be miles ahead. Instead, the task force had something like 18 months, but instead of making these investments, they signed a contract with a private provider first. We don't think that's right. That's why we joined with Dr. Nancy Pronik, with the Manitoba Association of Healthcare Professionals, and we called for a moratorium on these private sleep study contracts, for accountability and oversight on the contracts that exist, and regulatory limits to protect patients. We still think that's the right way to go, and we're hoping to see that from the provincial government.
Why is the Misery Group better than that? Because clearly the need is out there, and from what I'm hearing from the healthcare sector, there's more than enough to go around.
Well, I think that let's start where we're supposed to start. I listened to Dr. McDonald when he was on with you this afternoon, and what he said is that they look to solve problems in the public system first, and then go to the private sector to pick up where they say that the public system can't handle the load. It wasn't exactly that, but it was words to that effect. But that is absolutely not the case here. In fact, in this case, it is the exact opposite. The timeline was pretty clear. Absolutely nothing for months, a private contract with Cerebra out of nowhere, the docs being shut out of the task force and going public, and now the government is trying to go on the offensive and put the onus on the sleep doctors who have been working on behalf of patients this entire time. I don't think that's right. I think Manitobans can see through that, and I think it's time for the government to stop doing this in public and start getting the actual work done that needs to be done.
Some of the concerns of the sleep doctors that were raised, I did bring up with Dr. McDonald, saying they were concerned that those sleep studies being done by the private company in the community would wind up on their desk and perhaps supersede somebody else waiting for an in-hospital study. Dr. McDonald says that's not going to happen. The private company is going to hire the doctors and those others to interpret the results and to set up that treatment, in theory, to free up the Misericordia's facility to be dealing with other patients. And I guess my question is to you, in the meantime, is that not a sound solution until there can be more respirologists and technicians and equipment in place at the MIS to do this?
I think that what they should be doing is, instead of pushing these sleep doctors out for having the temerity to speak up on behalf of patients, they should be bringing them in on the process. This $1.8 million investment could have been made a year and a half ago, and we wouldn't even have to be having this conversation. I think it's pretty unseemly, quite frankly, of the government to send out the task force to do its dirty work in public instead of doing the actual work of bringing people together to come up with solutions that will actually work for patients. That's what I think should be happening here today.
Thomas Linner, thanks for your time.
Thank you very much.
Provincial Director, Manitoba Health Coalition.
Provincial government out today with a report